Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist. First things first, medial epicondylitis or golfer's elbow is not always a golf injury. It can happen from lots of different reasons. It's typically an overuse injury, though it can happen due to trauma or a blunt hit to the elbow. Typically the pain here will be felt on the inside of the elbow or the medial aspect, and it's typically on the medial epicondyle, which is kind of that little bone in that inner elbow area. If you push on it and it's pretty tender, or if you push just below it and it's more tender than the other side that's not hurting, that's a sign that there could be some signs of medial epicondylitis. What happens with that is that there's overuse, repetitive strain to that area. The tendons that control our wrist movement all attached to that medial epicondyle, and so it's not just the elbow that's involved. You also have to think about your wrist and the way that your wrist is moving. So lots of little micro tears in the tendon, and that's where a lot of that pain is being generated. Unfortunately, these kinds of repetitive stress injuries can take a long time, a very frustratingly long time to heal. But there are a few things that you can do to really help progress yourself along. So this video series is going to be broken down into three main parts because I feel like there are three, phases of recovery with this injury. And, of course, every person is different. Every progression is going to be different. So definitely seek advice from your doctor. Maybe get a referral to a physical therapist or a hand therapist or an occupational therapist to see what progression is going to be right for you. But this video is going to be the first part of the series. We're going to talk a little bit about the acute phase, or kind of the initial phase of getting the pain under control. This phase, I typically will think about modification of activities and bringing the pain down. So that's sort of where we're going in this first video. So in this acute phase of treatment, again, we're trying to bring the pain down. So number one, the first thing that you need to do are start to identify the aggravating activities. What things start to feel painful? What things are you noticing that are causing some of those symptoms that you've been experiencing? And avoid those aggravating activities, or find ways to modify or work around them. Some things that you'll want to avoid are carrying things with the palms facing up. So if you're lifting, on that side, try to have the palm facing down for a period of time. Keep the loads close to your body. You want to avoid the wrist being in a hyperflexed or extended position with activities, so keeping it really straight and neutral. Avoid tight, sustained gripping or grasping. Those are all things that you want to be careful of. If you're doing exercise like lifting weights or other kinds of exercises, make sure that you're avoiding the exercises where your arms are straight out in front of you. Keep them close to your body, or keep them in a more bent position. Those are going to be all things that can help to decrease the stress or the strain on that tendon that is currently trying to heal and recover. So number one thing is getting the rock out of the shoe. We've got to figure out what are the aggravating activities and how can we avoid them or modify them. Number two is using ice, especially acutely, right? Especially in that area. The first week or two of symptoms, I do think that ice can be particularly helpful. That's not to say that heat is not also helpful, but I think that when we are in acute inflammatory phase, ice does seem to really calm the symptoms down. Also, if you have done a lot of activity, maybe you've worked a really long day, you've done a workout, things are feeling a little bit more sore or painful, ice might be really helpful in that area. 10 minutes, a couple times a day as needed. You can actually also start to use heat in this course of treatment as well, because heat is going to help to stimulate circulation, blood flow. It's going to help promote tissue healing and elongation of the muscles that are really, really tight, and the tendon that's getting really, really tight over time. So putting a heat pack or a heating pad or warm water soaks in that area can also be really helpful. Kind of try both, see what feels best and see what helps relieve your symptoms the most. Again, heat is going to help bring in circulation, blood flow, help stimulate healing. Ice is more helpful with pain and also with swelling. So those can be really helpful things. Number 3 that you're going to start doing is about 3 times a day for a minute. You're going to do a really gentle massage. We're trying not to anger the area, so you don't want to dig with all of your might, right? We're trying to calm it down and not make it more angry. But if you can find that area where the epicondyle, where the bone is, and then look a little bit below it, that's a good spot where you can really promote some circulation and stimulation of that area with a little bit of massage. So I'm doing this overhead, which is probably not the most comfortable position, but I want you to be able to see. What I would do if I was, doing this on myself at home is I would rest it on a pillow or an armrest, and then I would come in and do my massage here. But you're targeting, again, that middle area of the elbow, right below it where we have some meat on the arm, and just doing a little bit of back and forth, gentle pressure, a little bit of massage. You could also use a lacrosse ball or a soft, stress ball or something like that, and kind of roll it along the muscle wad in that area as well. The 4th thing that I want you to start working on is some gentle range of motion, some gentle stretching. So that's going to mean not going to the point where it's very painful, but maybe feeling a little discomfort, a little bit of movement to the tissues. So the first stretch that you're going to do is with your elbow in at your side, 90-degree angle. And this is going to be an active movement. You're going to just gently bend the wrist backwards as far as you can. You can hold for a second and then bring it back in, and repeating about 10 times. Now, if that stretch doesn't feel very painful or it feels comfortable, you can move into the palm up position, because that's a little bit more stretch or a little bit more tension. Same thing, about 10 repetitions. And if that stretch feels comfortable or easy, then you're going to have your thumb facing up and your arm straight in front of you. And then same thing, bending the wrist back. You could do 10 repetitions here. If that feels really comfortable, no pain, then you can turn the palm up. Same thing, bending the wrist back. And then holding for a second, bringing it back up. So I like that variation of movements because, again, everybody has different symptoms, everyone has a different pain level and a different stage of recovery that they're at, and so we can kind of grade up or grade down based on where your pain is at. None of those exercises should cause pain. You don't want to progress to the next set of exercise or the next step of exercise unless you're able to do the exercise pain-free. So those are really the, I think the best stretches to do kind of for the elbow in that phase of time. I also think it's really important to work on some postural exercise. So when we are in poor posture with activity, our shoulders roll in, our back gets hunched, our neck goes forward. It puts a lot more stress on the muscles that attach at the elbow, the muscles of our wrist and our hand and our forearm. So if we can work on some postural exercises, things like opening the chest and stretching it out, getting a nice stretch through your front body, or maybe doing some like shoulder blade squeezes where you're just pulling the shoulder blades down and back, or maybe even just some big shoulder circles, working on keeping your posture upright and in a good position so that you're putting less stress down the arms. So those would be kind of the 5 main things that I would focus on during this acute phase of medial epicondylitis. So again, this phase is all about controlling the pain, getting it under control, helping it come down, and starting to promote healing. So I hope this video was helpful for you. Again, this is part 1. We're going to do a 3-part series here about medial epicondylitis. If you enjoyed the video, please give it a thumbs up. Don't forget to subscribe to the channel so you don't miss the next 2 videos of this series. And thank you all so much for watching. I'll see you in the next one.